the harsh reality is this, that because of the crisis that's taking place in the NHS at the moment, there are patients who are being put at risk, even without strike days taking place.
Nurses from the RCN union will go on strike for the second time in more than 100 years. Their first strike took place last week, and tomorrow, barring any last-minute deals, ambulance workers will go on strike too. Contingency plans have been made, government COBRA meetings have been convened, and exemptions have also been issued. But will those plans shield patients from the risk? And will the government negotiate at the last minute to avert the crisis? Let's speak to Will Quince, who is a health minister. Good morning to you.
Morning, Aasmah.
You'll have seen, I'm sure, the front page of the Times. It's a horrible thing to wake up to, actually. Heart attack patients to be denied ambulances. How have we got here?
Well, Aasmah, I agree with you. They're front pages that no politician or anyone up and down the country would want to see. The government has accepted the independent pay review body's recommendations in full. Nevertheless, some union members have voted to strike, and as a result, we've got strikes today via the RCN, and then tomorrow strikes for ambulance unions. They are deeply regrettable. I wish it weren't the case, but it's my job, Aasmah, to ensure that as much as possible, working with trusts up and down the country, that we ensure patient safety. That's what the public will rightly expect of me, and what I and the Secretary of State and others, as you rightly mentioned, through COBRA, through all of the industrial action that have been planned, and making sure that we're putting as many plans in place to ensure that wherever possible, the public are protected and patients are as safe as they possibly can be.
But I suppose the reality here, I suppose in terms of ambulances anyway, is what one NHS ambulance chief said to the Times, wanted to remain anonymous. The best we can hope for is that everyone stays indoors, no one falls over, no one gets ill, and no one has a car crash.
Well, the service is already under considerable pressure, as you know, and on strike days, the key thing is if anybody does have a medical emergency or there is a life-threatening condition, that they continue to call 999. If it's not life-threatening, if it's not an emergency, call NHS 111 or visit NHS 111 online. The health service is still operating. It's important that people do go and get the support that they need, but is there going to be disruption both today and then tomorrow with ambulances? Yes, there is. That is the point of strikes and why unions are doing it. But we've got to make sure that wherever possible, in particular, those who where there is a life-threatening need and emergency, the unions we've been absolutely clear with them that there is a minimum level of service that is expected and required, and it is being negotiated at the moment at a local level between unions and trusts.
Now let's look at the money. I know it's not just about money, it's about conditions as well, but 4.5% is what was offered. You said that the recommendations of the pay review body were accepted. In Scotland, unions accepted 7.5%. We know that the nurses have asked for 19% on nursing unions. Would you accept then that there perhaps a gap, that the gap that there is between 4.5% and 7.5% should not exist? Why not offer 7.5%?
Well, Aasmah, there's a couple of points there. The first is that we have an independent pay review body for a reason. It makes recommendations, then it's up to the government to either accept those or reject those. And in
but
this
are
case,
they perhaps
the government
out of date?
Well, no, look, I don't think they are. And last year the unions weren't making the same claim when the pay review body recommended 3% for NHS workers, despite a wider public sector freeze at that time, I believe, was 3 times the rate of inflation and higher than the government's own affordability calculation. On Scotland specifically, the 7.5 figure is just the headline. In fact, there is far more behind that in terms of other deals that have been done around working hours and time in leave. We've looked at the Scottish deal. The equivalent of that in England would cost £13 billion. So to put that in some kind of context, that's £13 billion, which would need to come out of the NHS budget, money that we are currently spending on care for patients.
The difficulty right now for nurses, I suppose, is that Rishi Sunak has ruled out plans for this idea of a lump sum payment. And he said that he will look at next year's pay review situation. That means that we could have strikes by RCN nurses and paramedics for 6 months?
Well, I mean, as well on that point, let's be clear. We're not just talking about nurses. Nurses are around 320,000 nurses, but nurses are part of an Agenda for Change contract, of which there are over 1.2 million people. That's why the figures are so huge. It's not just about nurses. I understand why nursing is a motive. I have nothing but the utmost respect and admiration for nurses. I think they do an incredible job. But actually, it's 1.24 million people, and that's made up of support staff, porters, cleaners, managers, basically all those who work within the NHS that aren't very, very senior managers or doctors. That's why the figures are so large here. And for every 1% over and above that 4.75% that the pay review body recommended, or the £1,400 per staff member, for every 1%, it's £700 million. That is why this is so difficult. But as I say, and the Prime Minister's made clear, we're now 3/4 of the way through this year. We look forward to next year's pay review body, which the result of which kicks in April. Now, if you'd have said to me, look, the government has taken the independent pay review body's recommendation and hasn't accepted it, then I think that would be, an argument for you to say, look, you need to look at this again. In this case, we've taken the independent pay review body's recommendation and we have implemented it in full.
What about the situation with paramedics? Can we just talk about that? Because there was some great trumpeting about the fact that the armed forces were going to help out. But it turns out, I suppose perhaps people already, would have realised this, that there's not much they're actually going to be able to do. They're only really going to be able to drive the ambulances. They can't go through red lights. And that they're certainly not able to treat patients in any way. I wonder how much help, with all the goodwill in the world that is coming from the armed forces, how much help they're actually going to be able to supply.
Well, the armed forces and the MACA request is part of a broader contingency planning, and we have around 750 armed forces personnel, and I want to say a huge thank you to them. I represent a garrison city of Colchester myself. I know that they always step up when the protection of the public is in question. They do have an important role, and that'll be supporting the service by driving ambulances. You're right, they won't be able to drive through red lights and they won't have the blue lights on, but they will play an important support role, and that's alongside other trust contingency measures, working with local authorities, working with adult social care providers, working with community full services, and then individual trusts also looking at taxi support as well to help get those to hospital that need so, but are not life-threatening or emergency situations in that sense.
OK, Will Quince, thank you. He is the Health Minister. Times Radio's Anna Cunningham spoke to former West Midlands Ambulance Service paramedic Victoria Barrett, who spent 31 years in the job. She asked Victoria how she'd felt about striking earlier in her career.
The decision whether to strike or not was really, really difficult. And I think now, I don't think I could support a strike. It would just go against every fibre of my being. The reason why I do the job or did the job was to go out and help people.
Let's speak to Unite's National Lead Officer, Onay Kasab. Good morning to you.
Good morning.
You'll have heard Victoria's words there. She says this would go against every fibre of her being. I mean, she doesn't work as a paramedic now, but she did for 31 years. Is that something that paramedics are struggling with, do you think?
Absolutely correct. And I have a lot of sympathy with that view. Even when it was at the stage where our members were voting for strike action, they were making clear to us that they were doing so with a very, very heavy heart. And now that members are having to take strike action tomorrow, they are heartbroken at the prospect. This is not something we wanted. Our members do not want to go on strike. But they've also made clear that as well as dealing with pay, this is about saving the NHS itself. And that's what's at stake here. And that's why people have voted, excuse me, people have voted and will be taking strike action tomorrow.
Let's talk about what is going to happen tomorrow then. The front page of the Times, heart attack patients to be denied ambulances. Presumably this is because heart attack patients come under Category 2 calls to 999. Category 2 is heart attack, stroke, sepsis and major burns. Category 1 is where immediate intervention or resuscitation is required, for example, because a patient's heart or breathing has stopped. Paramedics need to reach patients within 7 minutes. Can you just tell our listeners what's going to happen if someone is having a heart attack tomorrow? What should they do?
Well, first of all, we've negotiated locally with the trusts where our members are taking action, so that emergency cases under category 2 will also be covered. That can include cardiac related chest pains. The advice to people is still to be dialing 999. But the harsh reality is this, that because of the crisis that's taking place in the NHS at the moment, there are patients who are being put at risk, even without strike days taking place, because of ambulance delays. In the West Midlands, we've got figures that show that in 2020, one patient lost their life because of an ambulance delay. By September 2022, the figure for the year was 37. So what that indicates, and with a number of other figures looking at the delays in ambulance response times, is that patient safety is at risk now, even without strike action.
Okay, so there's a couple of issues there. We've spoken to paramedics on this programme who've said that, you know, one of the reasons that they think that the situation is in meltdown is because they're queuing for, you know, 10, 12 hours outside A&E. They can't get in. And we know why. There's not enough beds. Social care is in dire straits so that people aren't being discharged. But obviously also in terms of ambulance waiting times, why is that? Is that to do with not enough staff or too much demand? Why are ambulance waiting times already getting longer?
It's a combination. It's because of there not being enough staff. We've spoken to our paramedic members who talk about being on courses when they were being trained with over 50 people there, and now only 2 of those are left who are still on the job. But it's also the stress of the job, the high recruitment and retention problems, and also because of stress and sickness suffered by paramedics and by our ambulance members. So it is a combination of those factors, and absolutely key amongst those, yes, is the vacancy levels. And
then, so what is it that you want to stop striking? What is it that you want from the government?
All we've been asking for is negotiations that deal with pay. Now, we met with Stephen Barclay yesterday. Unite met with him, and that meeting lasted half an hour, where there was no negotiation on pay. Today, there is a meeting with Stephen Barclay at 1:30, which all the unions have been invited to, and that will last half an hour. That's all that's been set aside by the government for that meeting, and that will only discuss the emergency cover issues, and now refusing to discuss pay. So it's quite simple. We want negotiations, meaningful negotiations, to discuss pay, and tomorrow doesn't have to happen.
Nurses, the nursing unions have been asking for 19%, but you don't have a figure, is that right?
Yes, we've Unison, Unite, GMB. We've asked for figures that match inflation and beyond. Look, we will negotiate. That's the point we're making.
What does that mean then? 10% plus what, roughly?
Well, we go by the RPI measure of inflation, which is 14% at the moment. That's a realistic indication of the cost of living. The point I'm making is that in Scotland, we've negotiated. We've reached an agreement with the government in Scotland, which our members agreed to, put to a vote, and our members agreed to, and strike action wasn't necessary. There's no reason why we can't do the same in England and Wales. We're willing to.
Yeah, I mean, we had the health minister on, Will Quince, and he says it's unaffordable. Because every extra bit of money they give to nurses or paramedics takes money away from the health service, takes money away from patients. That's the government line on that.
We dispute that. We've commissioned research by an organisation called London Economics, which found that as well as the money that comes back to the government through taxes, because of the type of workers we're talking about, NHS workers, they're not going to spirit the money away in offshore bank accounts. They will be spending the money in the local economy. That will help offset recession. It will also help with dealing with the fact that the NHS spends something like 4.5 billion over the last 5 years on agency fees. So actually, a huge amount of the money could be recouped. So we dismiss the figures being put forward by the government. But the best way to resolve this is for negotiations to take place.
Okay.
We'll bring our figures, they bring their figures, and let's have a discussion.
Well, let's see what happens at 1:30 today. Onay, thank you. That's Onay Kasab, who is Unite's National Lead Officer.
Live on Times Radio Breakfast, Layla McCay, Director of Policy at the NHS Confederation. Morning.
Hello.
Let's think about, first of all, about what these strikes are going to do to the health service, which is already in a tricky situation, isn't it? It's inevitable that waiting lists will become longer, but is it also possible that many people are going to get more ill and even lose their lives because of this dispute?
Well, it's certainly the case that whenever there is industrial action of the type that we're seeing here, there is significant disruption to the health service. Clearly, health leaders across the country are doing everything they can to make sure that safeguards are in place, to make sure that patient safety is absolutely prioritised. But I mean, what we did learn from last week's strike was that more than 2,400 people who were due to have elective procedures were not able to have those as a result of the strike action. And, you know, we're starting to see those sorts of impacts. So certainly, I think that can give us some indication of some of the sorts of disruptions that we might see again repeating this week and potentially ongoing if a resolution is not found.
And of course, this December hasn't been a completely agreement-free zone. Some nurses in Scotland have reached a pay deal. On the train side of things, the TSSA has agreed some of the pay offers put forward to them. In terms of the nurses and the ambulance workers who are striking today and tomorrow, can you see a landing strip of agreement between what the government is saying and what the unions are asking for?
Well, it's certainly what health leaders are hoping for. I just think that the governments and trade unions can't afford to let this situation drift. This is a really difficult situation. The NHS is already under huge amounts of pressure. This is creating further pressure, and looking at the prospect of further strikes in the new year is very, very concerning. So yeah, the hope that we all have is that the government and the trade unions will get around the table, have a proper discussion and come up with a resolution, because this cannot go on indefinitely.
But what do you make of the government's view that actually they can't offer any more because that will just take money away from frontline services?
I mean, I think it's for the government to have those discussions. It's certainly not for me, but the government needs to engage in the way that is required to get things moving again, however that may be. And certainly health leaders across the country are hoping that they will have those sensible discussions. And this sort of stalemate that we've seen over the last week isn't helping anyone.
And just talk to us how bad the situation is, because one of the arguments put forward by unions is that the disruption isn't going to be necessarily as bad as many people are making out, because it's not so different to the situation we're already facing. The Telegraph has leaked data this morning showing that ambulances are already taking on average 90 minutes to reach a stroke or heart attack patient in some parts of the country. We've had a load of hospitals in England declare critical incidents yesterday. So will the disruption be that much different to the disruption that we're already facing?
So what you're seeing at the moment is the huge difficulties and pressure that's happening in the urgent and emergency care sector right now, when everything has been working as well as it currently is. But when we reduce that working by quite a significant degree, then it's certainly the case that there will be a lot more disruption. Clearly, that will vary across the country as to what that disruption is going to look like. In fact, the discussions about what services will be in and out are still being negotiated as we speak. But certainly, it's the case, if we're seeing huge amounts of pressure and challenge when everything's working at normal capacity, then we'll certainly be expecting to see a lot more disruption, and that will extend across the whole system. It will affect, primary care. It will affect people coming into accident and emergency departments. It will affect people who are in hospitals. It's going to have quite significant impact, and not just on the day itself, but we would expect to see that impact continuing over the next few days as well as the service recovers.
And just finally, on the topic of the disagreement which is being hopefully thrashed out today by the Health Secretary in England and some of the unions, what to do about the agreements struck locally between unions and ambulance services for the strike tomorrow in terms of which calls might actually get an ambulance, because there's still a lot of concern that even people reporting strokes and heart attacks might be required to get themselves to hospital. Are you hopeful that there's some agreement on that front? And is that entirely legal, that ambulance workers can just not respond to those calls if they're on strike?
Well, the discussions right now are how to maintain safety, so how to respond to those immediately life-threatening calls, and as to what is responded to beyond that is clearly a matter for negotiation. And health leaders are very much hoping that the negotiations will be successful in making sure that as many people as possible are able to get the service they need. Clearly, they're putting in other mitigations, like support from the military, from voluntary sector, from the independent sector. But yeah, clearly the priority of healthcare leaders is to get as many people as possible the care they need when they need it. The national advice is still to call 999 or 111 when you need it. But it will be the case, it seems, in some parts of the country that those services will be reduced, and people may look to convey themselves or whatever may be appropriate. So yeah, I think that across the country, everybody's trying to figure out the right mitigations at the moment, but really the best solution would be an agreement at the level of the government and the trade unions.
Layla McCay, Director of Policy at the NHS Confederation. Thanks very much.